Thank you so much for allowing me to come and stand in solidarity with you. This is our fight. We're here to tell you we stand with you, we respect you, and we want you to be taken care of. So please know that we're all back here just making sure that everyone hears that we want you to be taken care of. We want you to have the quality workspace that you deserve. We want our patients to have the quality care that they deserve. So shout, my nurses, shout, shout. Woo! Thank you so much for fighting hard. Thank you so much for being in the front line of taking care of our communities. Thank you so much for taking the time to come out as a unit and show everyone that we stand together in solidarity with your union. As a lifelong member of Teachers Union myself, believe me, I remember one time when I got fired and it was my union that got me my job back. So please know you have an ally in me. Know that I'm here to be in solidarity with your fight. Know that we're sending a message to everyone up there that's hearing us that we need you to be taken care of. So thank you very much, and I will continue to stand with you on this fight. So thank you. I want to hear a big shout, go! Woo! Thank you so much, and I will see you very soon.
Hello, my SEIU brothers and sisters. I'm Reggie Jones Sawyer, and a proud SEIU member of 721. And I'm here to stand in solidarity with my SEIU brothers and sisters on the line. But before I start, I want to thank the nurses. In December of 2022, I died after a minor operation. It were the nurses that brought me back to life. It's the nurses the reason that I am here today to stand in solidarity with you, to make sure that you get the benefits that you deserve, you need, because what you do is good for everyone, it's good for all the patients that are in that building. And most of all, and most important, this is a message to Dr. Wu. Dr. Wu, take care of the people that take care of us. And Dr. Wu, get it done quickly and quit being an asshole.
Let me just say here, it's a pleasure to be with you all today. And anybody who knows me will tell you that my true passion for this work comes from you, the rank and file members. Because when I see all of you standing there, shoulder to shoulder like you're doing right now, it reminds me that nothing, absolutely nothing can stop us. They may have the money, but we have the numbers, and we have the moral high ground. In Los Angeles, it is a hot labor summer. And you have now joined over 100,000 union members that are on strike. We have HERE with 50,000 members on strike. We have the Writers Guild with 11,500 members on strike. And we have SAG-AFTRA with 70,000 members on strike. And we have you that are now on strike. Welcome to the club. Workers across Southern California are standing up and demanding their fair share. And that's because what we all are fighting for is at the very heart of the labor movement. Our labor movement, as a labor movement, we will continue to fight for benefits, for safe working conditions for the nurses here at Garfield Hospital. That's one of your basic rights. And for Garfield to tell you that they can't provide a safe work environment, you say shame on them. For you to have to file an unfair labor practice because you don't feel safe going to work is unconscionable, immoral, and full of shit.
We are here today to say that it's time for change. Garfield, this is our our home away from home. And when your house is in ruins, what do? You fix it. We need to fix our problems. The staffing crisis has been going on for too long. We're overwhelmed, overworked, overburdened. Let's get some adequate staffing care in here. Stop the dangerous floating of nurses floating everywhere, every day. We need to fix our poor working conditions. Everything is broken, outdated. We're sweating in the rooms because there's no air condition. The plumbing sucks. We can't do charting with broken computers. The list goes on. We gave the hospital a 2-page list of outdated and broken equipment. So we need to fix all of that. We need to feel safe and secure with new protocols to keep the nurses safe from harm. Okay, we deserve better. Our patients deserve better. We are doing our best, but are limited because of the circumstances of the hospital not keeping up with good standards. We are essential workers, but our patients are also essential, okay? So today it's your voices, they're being heard today. We want to tell Garfield to care for the nurses so that we can care for our patients, to care for our community. We are the heart of healthcare, so we need to do our job, but have compassion on the nurses so that we can give compassionate care. So thank you for all coming, standing together. I'm proud of each and one of you.
Hi, my name is Rosanna Mendez. I'm the Executive Director for SEIU Local 121RN. Garfield Medical Center Nurses are on a 10-day strike. Today is day 8 of a 10-day strike. And they're on strike for 3 main reasons, aside from the hospital not being market competitive and not paying them wages that are competitive to the other AHMC-owned hospitals. The 3 top priorities are lack of staffing, so they don't have sufficient nurses to be able to do their job safely for patients. They don't have sufficient support staff. There's also an issue with a number of items related to broken equipment that have been in disrepair for quite some time, and the hospital has not addressed them. And then the other issue is safety and security, not just for the nurses here, but for everyone that works at this hospital, including for patients. One of the things that the hospital has instituted, unfortunately, is that they put the responsibility on nurses to check personal belongings of patients when they enter the hospital and to confiscate weapons, and that includes knives, guns, and other weapons that can cause harm. The nurses asked for metal detectors and others and increased security, and the hospital just flat out rejected that proposal. So those are really the things. It's staffing, it's security, safety and security for the healthcare workers, including the nurses, and for patients, and also for broken equipment.
I hope that you never have to deal with the problem of medications, you know, where the antibiotics that are going to help protect you are delayed and you enter sepsis because of the delay in the antibiotics. That's what I really hope you guys don't encounter, because that's what's kind of happening. And like I said, it's an epidemic in between all hospitals. Some are better than others, but they are now what appears to be putting their profits first and sacrificing patient care, sacrificing the nurses in the process. Everyone under Dr. Wu's allegiance also falls into that umbrella.
And it's a multi-billion-dollar corporation. They own 10 hospitals and they pull in billions of dollars. So there's absolutely no excuse for them not to invest in patient care. The equipment that we're using is so old and outdated, it prevents us from doing our jobs and delivering the care on a timely manner. And it's really, there's no excuse for it. They have the money, they need to invest it in patient care.